Welcome to The Explainer. Today, we're diving deep into a fascinating story, the story of a wound that just won't heal. For so many people, this becomes a literal battle fought just beneath the surface of the skin. So let's pull back the curtain and take a look at this hidden battlefield. It's a question that can be maddening for both patients and doctors, right? You think you're doing everything you're supposed to, but the wound just stops. Or maybe it even gets worse. So what is going on here? Well, the answer isn't simple. It's a microscopic war, a conflict that escalates in some pretty distinct stages. Okay, to really get this, we need to stop thinking about a wound as just, damaged skin. Think of it as a piece of territory. The second that territory is exposed, a race begins. It's a battle for control between your body's defenders and an army of invading bacteria. Now, the first real fight is what we all recognize as a local infection. This is the moment when those invading bacteria have broken through your first line of defense, they're starting to multiply, and they are making their presence known, loud and clear. You know these signs: the redness, the heat, the swelling and pain. These aren't just symptoms. They are your body's alarm bells. It's battle cries. It's your immune system shouting, "Hey, the perimeter has been breached. We are under attack right here. The fight is officially on." But what happens when the invaders get a little more clever? Well, that's when we can slip into a much more dangerous and kind of sneaky phase. It's called critical colonization. And this is where the whole dynamic of the battle shifts, because the invaders are gaining a serious advantage, but they're doing it without setting off all those noisy alarms. And this, right here, is such a crucial difference. A local infection, it screams for attention. You see the redness, you feel the pain, but critical colonization, it whispers. There might not be any of that obvious inflammation, but the healing just grinds to a halt. The number of bacteria has hit this invisible tipping point where it's now actively sabotaging any attempt to recover. It's a silent takeover, and that's exactly what makes it so easy to miss. So if that silent takeover is allowed to continue, this is where things get really, really serious. The bacteria aren't just fighting anymore. No, they're building. They are setting up a permanent, heavily defended settlement right in the wound. And this incredible structure is called a biofilm. So what is a biofilm? Well, it's not just a big clump of germs. It's way more sophisticated than that. It's a highly organized community, almost like a city of bacteria. And this city builds its own protective dome, this slimy, sugary shield that makes it almost impossible to attack. And this fortress doesn't just pop up overnight. It's built deliberately, step by step. First, a few bacteria land and attach. Then they start to multiply, forming these little neighborhoods or microcolonies. But step 3, that's the real game changer. That's when they start producing that protective slime matrix. And finally, the whole thing matures into this complex three-dimensional fortress, turning a simple group of invaders into a seriously tough opponent. And this fortress is just incredibly effective. That slime shield, it physically blocks your own immune cells from getting in. And this is so important. It also blocks things like antiseptics and even powerful antibiotics that are flowing through your system. On top of that, the bacteria inside can go into a kind of hibernation mode, which makes them even more resistant. It's no surprise then that biofilm is the #1 reason why some wounds become chronic and just refuse to get better. Okay, so we have to talk about the absolute worst case scenario. What happens if this infection breaks containment? If the bacteria manage to escape the wound fortress and get into the bloodstream, well, the local battle is over. It has just become a full-blown, body-wide war. And that war is called sepsis. Let me be absolutely clear here. There's no gray area. When that infection spills out into the body and triggers this massive, system-wide panic, this is a life-threatening medical emergency. It needs immediate, aggressive medical intervention. And the warning signs for sepsis are completely different. They're not just at the wound anymore. Now we're talking about things like a sudden fever and chills, a heart that's racing, breathing that's way too fast, maybe even confusion. These are all signals that the enemy has broken out of its containment and is now attacking the entire system. So, when you're faced with an enemy this sophisticated, especially one that's built a fortress, How do you possibly fight back? Well, you can't use the old tactics. It just won't work. You have to fight smarter.
The key is a two-pronged attack. You can't just lob antibiotics at that biofilm fortress and hope for the best. The walls are just too strong. So the first, most critical step is physically taking down the walls. That means aggressive cleaning and debridement to literally dismantle and remove that protective slime. It's only then, once the shields are down, that you can go in with targeted antimicrobial treatments to actually get to the bacteria inside.
And this really gets to the heart of it, doesn't it? This is a fundamental truth in modern wound care. You can be on the strongest antibiotics available, but if they can't physically get to the bacteria because of that biofilm shield, they're not going to do much good. The attack has to be direct, and it has to start with bringing down the walls. All right, we've journeyed through this entire microscopic war, from the first little skirmish all the way to these impenetrable fortresses. So after seeing all that, what's the most important lesson? What's the big takeaway from this whole fight? Winning this battle isn't about finding one magic bullet. It's all about strategy. It's about being a really good battlefield commander. That means knowing exactly what stage of the conflict you're in and then tailoring your attack to that stage. It means prioritizing demolition, breaking down those defensive walls before you launch your main assault. And of course, it means using the right weapons and keeping a close eye on the battlefield at all times.
Looking this closely at a chronic wound, it just reveals this whole hidden world of strategy and conflict, doesn't it? And it leaves you with a really big question. What other silent, microscopic wars are being fought inside our bodies every single day, shaping our health in ways we're only just beginning to wrap our heads around?